Good afternoon, everyone. Thank you for joining us. Welcome. I'm Avital Habusha. I'm the Vice President of Programs here at the New York Health Foundation. Thanks for joining us today to discuss New York State's Public Health Corps and how it served as a model to strengthen the workforce throughout the state. Before we get started and I introduce our speakers, I just want to do a few housekeeping items. We'll be recording the webinar and a webinar recap with the link to the recording and other materials will be circulated afterwards. Your video and audio as participants are disabled, but we invite you to use the chat freely. We'll be monitoring that throughout the presentation, and we'll have some time at the end for questions and discussion, so feel free to share there. And there is also a closed captioning feature, which is available at the bottom of the screen if you choose to use that. So just to introduce where we are today, as we all know, the pandemic exacerbated existing workforce challenges for the nation's public health system. We've seen growing strains on local and state health departments across the country. Recent research really bears that out. It has documented high rates of burnout and staffing losses, and including one study that found that state and local health departments need a massive workforce increase, upwards of 80,000 workers, full-time employees annually to deliver essential health services. And so today we're going to discuss one solution that's being implemented here in New York as part of the state's overall commitment to expand the healthcare workforce. So the New York State Public Health Corps, which you'll hear about, is a first in the nation program that aims to strengthen the workforce so it's prepared for future emergencies and so that it promotes equity and is reflective of communities. And fellows throughout the program are really helping tackle a range of issues, including communicable disease surveillance, drug overdose, reproductive health care. And I'm excited for you to hear today from some of those leaders on the ground who are supporting those fellows. We'll discuss the program's successes, and some of the gaps and upcoming challenges it's facing, and how we can really leverage this program and others to diversify, expand, and strengthen New York State's public health workforce. So we have a great group of panelists, a lot to talk about, and so I'll introduce them now and we'll jump right in. So first, Erin Norrell, who's the director of the New York State Public Health Corps Fellowship at the New York State Department of Health. Dr. Gail Burstein, who's the commissioner of the Erie County Department of Health. Sarah Ravenhall, who's the executive director of the New York State Association of County Health Officials. And then Tara Schaefer, who is the executive director of Literacy Buffalo Niagara. We'll talk about some of that on the groundwork. And Danielle Rovillo, who also is a project coordinator for health equity at the Erie County Department of Health, who also give us a flavor of what's happening on the ground. So I'm going to turn it right over to Erin to get us started and introduce us to the program. If you can bear with me for one moment, I'm going to share my screen. Let's see. Okay. Oh, we're kind of, let's see, I've got to go backwards. Sorry about that. Okay, so Erin, I'm going to turn it to you and let me know when to advance the slides.
Sounds good. Thank you, Avital, and thank you for having me on today's webinar. As Avital said, my name is Erin Norrell. I'm the director of the New York State Public Health Corps Fellowship Program, which is a governor's initiative managed by the New York State Department of Health. So a little bit of background about the New York State Public Health Corps Fellowship Program. We're a relatively new program. We were first announced in the governor's January 2021 State of the State address, as Avital said, as a first in the nation state-based public health corps aimed at enhancing public health capacity to support COVID-19 vaccination operations and increase preparedness to respond to future public health emergencies. The key goal was to bolster the state's public health infrastructure and capacity by mobilizing 1,000 fellows across the state to provide critical support and services to both local health departments, but also the state health department. So in those first 6 months of 2021, the foundational components of the program were formalized. Funding was secured through 2 Centers for Disease Control and Prevention cooperative agreements, and the fellow and funding methodology was calculated. So counties were allocated between 1 and 90 fellows based on their county size, the number of COVID cases at the time, and several community health indicators. Based on the number of fellows, a funding award was determined for each local health department for a 2-year period. So in July of 2021, local health departments received their letter of engagement, and at the same time, the call for application was released to the public. Throughout that summer, the fall, the winter, the department built up its programmatic teams. We worked closely with local health departments to establish their contracts, and the very first fellows were hired. The fellowship program was created to really bring an influx of staff to local health departments to assist with COVID-19, particularly emergency testing and vaccination pods, engaging community partners to address or help with the COVID-19 pandemic, focus on communication efforts, or even to assist with data analysis or setting up dashboards. And that individuals would be brought on to work for 1 year, again, to increase that capacity at the local and state level. What I can say is what we quickly learned, especially from local health departments, that this limited scope and the timeline was too restricted for them, in the midst of the pandemic. They told me they didn't need people to work in pods. What they really needed were people to come and work on the programs and initiatives that were put on the back burner because of COVID. Also, that 1 year just wasn't enough. By the time that they trained someone, that person would have to leave. So, at the health department, we took this feedback extremely seriously, and we consulted, the notice of award to kind of see, okay, we've got a little bit of flexibility here. I'm proud to say we were able to expand that scope to include COVID-19 response, but also recovery. And what we were able to justify is that recovery meant working on programs and initiatives that were impacted by COVID-19. We also extended the length of the fellowships. So actually, currently, we have fellows who've been with the program longer than 2 years. I will say the fellowship program is more than just filling positions, at a local or state health department. It's about professional development really at its core. So all fellows under the program have the opportunity to take Cornell University's Public Health Essentials Certificate program, the University of Miami's Building Expertise in Administration and Management Certificate program. We held quarterly regional consortia meetings and monthly educational series webinars. In addition, each year we've held an annual in-person summit where all our fellows and partners come together for networking and shared learning. These activities and really aim to increase not only the knowledge, but also the skills in 10 public health core competencies that we've adapted from de Beaumont's strategic skills. We believe that by facilitating the fellows' development in these core competencies, we're building a workforce that is greater than the sum of its parts. So next slide. So NSPIC, or the New York State Public Health Core program, is a community-based program at its core. So we divided the state into 10 regions. 9 of them are geographic. You'll see them in different colors. And the 10th being the New York State Department of Health, which is kind of those little red thumbtacks, if you will. I do want to note that New York City is not included in the public health core, and this is only because of our funding source. New York City received those same 2 notice of awards from the Centers for Disease Control and Prevention that we are funded by, so you can't cover the same geographic area twice. They do have their own public health core, which is focused on training and deploying community health workers. So again, of our 10 regions, I think one of the smartest things we did is we hired a fellowship placement coordinator and a specialist who are from these regions or have established connections in this region. This helped us make inroads with local health departments to get them on board. I can say there was one area where I tried to, get in communication, with the public health directors and didn't hear back. And within, 2 weeks of our coordinator coming on board, she had calls with them set up. So we really kind of want to, this is a community model, have people from the community working at the state health department as well. We've been pretty fortunate. We've had counties being able to opt in. So I said we launched in 2021. We had 6 counties come on board in 2023, meaning we had many before that. But that we had the flexibility that some who were not early adopters, recognize that this program would work for them. So we've had 51 local health departments participate in the public health core to date. On the left side of the screen, are our established regions. On the right are really the fellows who joined the program. So to date, we've hired 635 fellows with 324 currently employed as of last week. Western New York by far has the highest fellow count, and that is because of Erie County, who you will hear from right after me. We also received a no-cost extension. We were supposed to end in June of 2023, so we received a 1-year no-cost extension, and that allowed some fellows to stay on longer, and some new fellows to be recruited. Next slide. So who we are, I thought maybe you'd want to know who are our fellows, how do they compare against the National Public Health Workforce? So the Public Health Workforce Interests and Needs Survey, also known as PHWINS, is the main source of data on the National Public Health Workforce, and they collect a variety of demographic data. So when we look at the PHWINS dashboard from 2021 and we compare it against our fellows, our program has a higher percentage of fellows that identify as Asian, Black or African American, white, or multiracial. We collected our data within 1 month into their fellowship via a survey. Also compared against the PHWINS dashboard, our fellowship program has a higher percentage of fellows who identify as male, or non-binary or third gender. We also have a greater percentage of fellows that have completed a bachelor's or a master's degree. Next slide. So, as a new program, program evaluation is paramount. Our fellows and supervisor surveys are really a key way for us to collect data throughout implementation. We send quarterly surveys to fellows and their supervisors starting about 3 to 4 months into the fellowship program. You can see here that the satisfaction rates for 3 of our surveys. So Fellow Survey 2 and Supervisor Survey 1 are in green. Fellow Supervisor 3's Supervisor Survey 2 is in blue, and Fellow Survey 4 and Supervisor Survey 3 is denoted in yellow. Fellows who responded to the survey felt largely satisfied with the program, with a greater percentage of fellows feeling very satisfied in those later surveys, and the greater percentage of fellows feeling unsatisfied in those earlier surveys. The majority of our supervisors are also satisfied with the experience with the public health core, though they do have a lower response rate. Next slide. So we're 3 years in, and we're already, seeing benefits at the organizational, local, state level. Right now, we're kind of in the evaluation of this first phase of the program, including successes and impact. So I just wanted to share, visually, I won't read them on the screen, but these are just directly from supervisors of how they found benefit from the fellowship program. Fellows have brought funding into the program, they've expanded what the health department can do or in different areas like communications. So we're really proud of the work of our fellows. Next slide. So we view the fellowship program as a promising approach, not just for developing the public health workforce, but also building it up. We view the program as a possible pipeline, right, to enhancing that public health employment, and our preliminary data shows that. This graph represents 63% of our inactive fellows who have accepted positions, after leaving the program in public health or health care. The remaining fellows had either resigned, were let go, or their fellowship term had ended. So I just want to end, we're in this current iteration of the program. It's ending for our fellows at local health departments and the community the end of this week, and at the state health department at the end of next month. We're launching the next iteration of the program. We've received a 2-year no-cost extension. And so we're actually currently recruiting. So if you know of anyone who's interested, check out ny.gov/public health corps. It still has the same foundational components of the program, except this time around, it'll be a set 2-year term. We have all of those professional development components, more statewide ones as well, to bring all those 200 fellows together. The biggest change is that all fellows will be hired by the public consulting group this time around. And that really just kind of ensures pay equity across our fellows across the program. So just wanted to say again, thank you for having me, and definitely, can answer questions at the end. So that's it for me. Thank you.
Thanks, Erin. So I'll turn it over to Dr. Burstein, who can kind of tell us a little bit more about that experience in Erie County, where you've had so many fellows across the state. So I will switch it over to your slides and turn it over to you.
Thank you. Again, I'm Gail Burstein. I'm the Commissioner of the Erie County Health Department. And I have to say, we were early adopters of the fellowship program. We really saw this as a great opportunity. I'm going to describe that in a minute, just the reasons we really embraced this program. And then I'm going to turn it over to Tara Danielle to talk about their own experiences with the fellows working with them. So first of all, we all know that over the years, public health program resources have been shrinking, which became very evident at the onset of the pandemic, where the all hands on deck pandemic response gutted many of our core public health operations, where many health departments are still recovering. And so with the Public Health Fellowship Program, the Erie County Department of Health saw the opportunity to build a robust, diverse, and dedicated public health workforce that represents Western New York communities and uses the strengths of the community to achieve health equity. So that's what we were all about. Next slide, please. Thanks. So this slide includes photos of the Erie County Department of Health leadership, including our county executive on the right, in the top left-hand photo, the New York State Public Health Corps Western Region office staff, and then our public health fellowship supervisors, and a large group photo of many of our Erie County public health fellows at a big research presentation day that we had at the University of Buffalo. So when the Erie County Department of Health was informed about the Public Health Fellowship Program, we embraced and expanded the opportunity, and we really reaped the benefits. So this New York State funded Public Health Fellowship Program expanded our county's public health workforce with very smart, energetic, and passionate people from diverse backgrounds and professional experiences. So Erie County's Public Health Fellowship Program grew to 113 fellows and 6 fellowship supervisors. At our health department, fellows were placed to work in a variety of roles, such as program planning and implementation, communication support, epidemiology and data analysis and research, partnership development, vaccination and testing site support, and training and curriculum development, and also in a variety of public health fields, such as emergency preparedness, public health laboratory, cancer screening, food policy, health equity, harm reduction, community health assessment, gun violence prevention, and family planning, just to name a few. Next, please. So we not only increase our local health department's public health workforce, we actually place many of the fellows in Erie County at community-based organizations that could otherwise not afford to hire additional staff to accomplish their important and vital work. So whereas the Erie County Health Department, we place 23 fellows at in various sites in our department. There were 90 fellows that we placed in our community based organizations in Erie County. So this slide shows some of the community-based organizations where fellows were placed. Next, please. So this slide presents photos of our Western New York fellows presenting their research and projects at a New York State public health meeting. So this means to me, AKA, this fellowship was very successful. And if I just want to take a minute to toot my own horn, I also had a fellow working with me. We were working on some gun violence prevention activities. And so our fellow, with my mentoring, worked with our DA's office and a couple of lawyers that are very experiencing in filing extreme risk protection orders. And we put together a roadmap for healthcare providers to about how to file an ERPO. And then our fellow, again, with my mentoring and another physician that's experiencing gun violence prevention, we looked at the New York State's ERPO database on that reports on people on whom ERPOs were filed and they had temporary or full year ERPOs, and we looked at minors in this database, and we wrote an abstract, and it was actually accepted at a very competitive pediatric academic meeting, the Pediatric Academic Society, which was, it's also an international meeting. Fortunately, it was in Toronto, Ontario. So in Buffalo, it was easy to get to, except we had to jump through hoops with international travel. But I think that we were really successful. So the New York State Public Health Fellowship Program is an important investment in the public health workforce. So people are more likely to work in a public health field if they receive the experience during their training, just like all of us. So this was also a local investment where 70 of our Erie County fellows were University at Buffalo Masters of Public Health graduates who we hope will stay in Erie County or Western New York after their fellowship ends. So this is really also a local investment in public health. A number of Erie's public health fellows already joined the public health workforce, both in and outside of Erie County. As of May 2024, a number of fellows were hired into full-time positions, including with the Erie County Health Department, so we were able to hire some, Trillium Health, the Council on Education for Public Health, the New York State Association for Rural Health, Vanderbilt's Memory and Alzheimer's Center, and I know even more were hired since we did this tally into other positions, and so we think that they're really able to find great jobs and contribute to our public health workforce. So I know one of our fellows who I also mentored was accepted into medical school, and she's just starting her second year right now. So that was also like a real joy to see. Our public health fellowship are training grounds for future public health employees, especially after the pandemic. People who work in public health and healthcare, as their careers are retiring and leaving, we need people to fill those positions. Public health, even if the public health fellows don't end up working directly within the public health field, they bring in a public health perspective wherever they go. So, and I think that is, really important. Again, I think we achieved our goal in investing in the public health workforce in our community and contributing to the overall public health workforce of our state and hopefully our nation. And so I'm going to turn over now to Tara, if she was able to join us, and Danielle, just to talk about their experiences. Danielle worked, of course, is within the Erie County Health Department, so her experiences with a fellow was in the department. And then Tara, of course, is with an experience with one of our community-based organizations.
Great, thank you. I know Tara was having a bit of trouble, but I think that Tara, it looks like we got you in. So, are you ready to be kicked off, or do you want Danielle to go first?
I am happy to kick things off.
Great.
I apologize. Can everyone hear me?
Yeah.
Okay, thank you so much. My name is Tara Schaefer. I'm the Executive Director of Literacy Buffalo Niagara. Thank you so much for the opportunity to share our experience with regards to the New York State Public Health Corps. First, I would like to share some information on Literacy Buffalo Niagara. Founded in 1965, our mission is to develop literacy skills by providing free tutoring in Erie and Niagara counties through engagement and training of diverse community volunteers. Our vision is that all people in Erie and Niagara counties are literate. Now, you may be asking how our community-based organization aligns with public health, and rightly so. For many decades, we have defined literacy as a social determinant of health, and we saw firsthand just how important being literate was during the COVID-19 pandemic. I would like to commend Erie County for understanding the importance of a literate community and appreciate the occasion to partner during Health Literacy Month, which is October, where we collaborated and aligned on messaging on the importance of health literacy and equity. Since 2022, Literacy Buffalo Niagara has hosted 3 New York State Public Health Fellows, and I would like to recognize Erica, Hex, and Anna for their outstanding impacts on our organization. Throughout their fellowship, we were able to expand our community presence by attending numerous events to recruit volunteer literacy tutors and students in need of literacy help, enhance our digital literacy programming, which has a specific focus on telehealth support, and leverage funding to support our health literacy programs. And we were the recipient of the coveted Highmark Blue Fund in 2023. I cannot express enough how grateful we were for the opportunity to participate in the New York State Public Health Corps. The entire experience exceeded our expectations. I would like to commend Dr. Burstein and her team for running such an outstanding program. I would also like to recognize Tanya Islam, who was our main point of contact and a huge source of support every time I needed her. Lastly, I wanted to share, and I'm excited to share, that Literacy Buffalo Niagara will be retaining 2 of our public health fellows moving forward and will be members of our team. And we are very hopeful for what the future holds. Thank you again for this opportunity.
Thanks, Tara. So I'll turn it back to Danielle. Danielle, did you want me to pull up that picture again for any background or?
No, I think I'm
Okay.
good with this. Yeah.
Great.
So I'm Danielle Ravillo. I use she, her pronouns. And like Dr. Burstein said, I'm in the Office of Health Equity, which is seated within the Erie County Department of Health. I just want to share a quick thank you to NISPIC and New York Health Foundation and Dr. Burstein for the opportunity to share about this work. One of my assignments that I'm very passionate about and get to work, I'm lucky to get to work as an Erie County staff support with the Food Policy Council. So I supervise the fellow that is in the role with the Food Policy Council and also support the work that the Food Policy Council does. So the Food Policy Council of Buffalo and Erie County is a body of county staff and community stakeholder volunteers that advise the county on matters relating to our local food system. And as we all know, the food system is super broad, so this work can get very complex really quickly. For more than 10 years, the Food Policy Council had relied on volunteer and very limited staff support, which made progress difficult and sometimes created barriers in regards to the council's ability to respond to emergency situations, namely the pandemic, but as well as the fatal blizzard and tragic mass shooting that we experienced here in 2022. So with the fellowship program, Erie County was able to bring on 1 full-time coordinator that focused on the Food Policy Council and its 7 subcommittees. Note back to how I said the food system is very complex. There's a lot of committees on this council. The coordinator has been able to diligently grow the Food Policy Council's social media presence and create a host of resources that address the social determinants of health. So it supports our work here in the Office of Health Equity as well. We now have social media series covering topics such as emergency preparedness, extreme heat, how to start a food business and shopping on a budget, and also long-term food storage. And we also publish a quarterly newsletter, and we maintain a listserv of food system resources for all the CBOs that are connected to the council as well. All of those resources are available to view on our Instagram account, which I think they're going to share in the chat for you. There's links up in our bio too that you can go and look at if you're interested. In addition to these series, we're able to establish a rapid response protocol for emergency situations. So we're making sure that the county has access to the most accurate and safe information to share on topics such as storing food during a power outage or what to do if you can't get to a store and you're feeding a baby formula. We also have a business startup resource on our website that covers just about any food-related business opportunity that you can think of. So it points users to all the different permits and applications they need to be in compliance with municipal, county, and state regulations. And this tool has supported many of the new food businesses that popped up since the pandemic onset. So all those sourdough and whatnot, but also all sorts of different healthy retail businesses. The coordinator has also worked really hard to bridge connections between the Office of Health Equity, the council itself, and other divisions within county government that have always worked alongside each other, but probably not in this context. So we're connecting and weaving food system stuff into everybody's regular day-to-day. So reinforcing that work that the social determinants of health are ever present in all of our work as county government. And so, for example, the coordinator recruited new representation to the council from the Department of Social Services, Senior Services, and also Public Health Emergency Preparedness. And that makes our responses and any advice we give just so much more robust. The increased visibility and community that she's built around food has helped the FPC create a set of attainable goals for 2024. So we have 3 buckets, emergency response being one, regulations supporting a collaborative farming model be another thing we're looking at, and then also boosting healthy retail commerce. And these goals include collaboration from multiple sectors, all at the ends of a sustainable and just food system for Erie County. The coordinator is able to track the progress, report on information. There's always data coming out, and she's, putting out reports regularly that, could be in the hands of Dr. Burstein, anybody on the Board of Health, or anybody in the county overall. We now have the capacity to attend community engagement events, which we were really never able to do before. So this way we can share our accomplishments and raise awareness for food system issues, and then also recruit future stakeholders to join the council. And lastly, I'll note that the Food Policy Council coordinator was able to write 2 really great grant applications. These are our first grant applications as the Food Policy Council, one that was recently funded through New York State, and it's called New York Families for New York Food. You may have heard of it here locally. The Buffalo Public Food System has the round 1 funding, and they're doing like a farmer's market. This grant, our award, will bring $1.1 million into our local food system, which is a huge accomplishment. And we'll provide fresh produce for families utilizing daycare facilities in areas deemed to be lacking fresh food access. We're very excited to start that project this fall. The other grant application is still pending, but it's about boosting awareness. And if that funding stream doesn't work out, we'll look for another avenue to fund that project. We're really excited about that one too. So none of this work would have been possible without the coordinator role. And we're so thrilled that we get to keep our coordinator, who is Colette McDonald. She's going to stay on for another 2 years as part of the next cohort of the fellowship. So thank you.
Thank you so much, Danielle. And I am going to bring it back home, talk a little bit about some of the public health workforce trends, how public health is resourced nationally and in New York State, and tie it back to programs like the fellowship program that is so critical in addressing, this need. So I represent the New York State Association of County Health Officials, which is the membership association for the 58 local health departments across New York State. And I'm really fortunate in my role as executive director, representing our governmental public health workforce who are tasked with providing core public health services to their communities in New York. So what this means is that I work really closely with local health departments. I speak regularly with their leadership, their staff, and I come to understand the challenges that they're facing in their local work. If you want to learn more about NYSHO, we're going to drop a link in the chat so that you can read a little bit more about us. So, most notably, the challenges that we're looking at right now are related to workforce. Prior to the COVID-19 pandemic, we are on the precipice of a retirement crisis with a large percentage of our public health workforce eligible for retirement. And from our experience and what we lived through COVID, we know that the pandemic really exacerbated a wave of early retirements and a loss of longstanding expertise from local health departments. So throughout and annually since the pandemic, working in partnership with our partners at the Region 2 Public Health Training Center, our dedicated team of employees has worked diligently to enumerate the local public health workforce on an annual basis. This allows us to help to communicate trends in recruitment, retention, and hiring of public health professionals. So some of our most recent data from 2023 reveals the following statistics. So overall vacancy rates within local health departments are growing, with a 16.7% rate that we saw in 2022 and a 17.6% rate in 2023. What that means is that between those 2 years, only 1 year, we saw a 1% increase in vacancy rates. That means more unfilled positions at local health departments. So we don't want to see that trend. Although 1% may seem minimal, it's a trend in the opposite direction, and it's concerning, especially post-pandemic. I'm aware of some singular departments where even more striking vacancy rates do exist, some at approximately 50% vacancy rates. By position types, registered nurses and community health worker positions constitute the largest vacancy rates, at about 24.5% for the nursing positions and 28.5% for the community health worker positions. So key challenges to hiring as reported by local health departments include salary offerings being lower than compared to the private sector. So it can be really challenging to hire within local governments due to that. The civil service system being really out of date, it needs to be modernized. And there are policy solutions that we're looking at to address that. The civil service system equally is a deterrent to applicants applying for those jobs. And when you're thinking about an equitable workforce, one that represents the individuals living in your community, that is a really important consideration for hiring. Additionally, difficulties in finding qualified applicants to fill those positions. So that could be public health nurses, but it could also be environmental health engineers or sanitarians. So we're going to pop in the chat a link to a research article that we did release on enumeration studies, our enumeration data, so you can check that out. But all in all, these workforce trends are really alarming. And when we think about the reliance on our public health system, we think about our collective ability to respond to emergencies and threats to public health. So when you're thinking about communicable diseases, you may have heard a little bit about H5N1, for example, in bovine or cows. And we in New York have quite a few cows. We're the dairy state, right? Or Mpox. Right after COVID, we addressed 2 outbreaks of Mpox. Just a few days ago, it was really hot outside, and there is a connection between health and heat, right? So local health departments were busy working to support their communities. Perhaps some communities lost power. Maybe there were some individuals who needed water or cooling centers. And perhaps there were unhoused individuals who were out in the heat and feeling the impacts of that. Making sure foodborne illnesses in our restaurants and our food service establishments are safe. Or maybe some of you are going on vacation in New York and swimming, and you want to make sure that the water you're swimming in doesn't have high levels of contaminants or harmful algal blooms. So these are all things that our public health system addresses and that we rely on sometimes without thinking about where that workforce is coming from and how it's resourced. So it's important, and it's easy to see why local health departments were really encouraged by the state's public health fellowship program, which placed hundreds of temporary workers into local health departments or community-based organizations, as Erie County did across the state. So this program really came at a much needed time for public health, and we're happy to see it continue. When we're thinking about workforce trends, we also need to think about funding and the resources, how our public health system is resourced, right? What does that currently look like? Post-pandemic, one might think we would have learned our lesson to ensure the public health infrastructure is fully funded, but the reality is that is not the case. In fact, we are actively preparing for the federal funding cliff that could jeopardize these systems even further. So back to early pandemic days, funding from the ARPA, American Rescue Plan Act, came on the onset of the pandemic to ensure emergency response dollars really got down to the locality. So we're seeing an infusion of money from all angles. In addition, to ARPA, in New York State, we were fortunate to see money flow down from the State Department of Health and other private sources. In fact, some of our rural local health departments were really, really pleased when New York State Health Foundation stepped up to aid response efforts during the pandemic. And while this money was appreciated and desperately needed, it's important to think about what is needed to accept and administer funding. So you're going to need fiscal staff. You're going to need a trained and competent, steady workforce. You need approval and support from local elected leaders to approve and utilize that funding. So all of those factors, are really important to consider, and to effectuate change and implement the programming that we needed. Our members in local health departments work really diligently to staff up and prepare for the influx of the funding. Yet the funding is continually coupled with restrictions on how to appropriately use the dollars. So, an example of some things we heard: you can use this money to buy supplies for a pop-up tent to hold your immunization clinic, but you can't use it to buy the vaccine itself. Okay. So I'm not sure how that makes sense, but it's things like that that we need to think about. And now we're seeing this emergency funding dry up, and we are anticipating a monumental shift in our budgets to conserve costs, which could mean the elimination of resources and jobs locally. For public health, this is not a good thing. Nationally, according to a 2023 report from Trust for America's Health, state and local health departments are facing an annual shortfall of about $4.5 billion to be able to provide comprehensive services in their jurisdictions. So we'll pop a link in the chat to that report in case you want to do some advocacy on your end. And public health systems, as we all know, have been operating under decades of chronic underfunding. So in fact, nationally and in New York, governments spend about 3 to 5% of its total health-related public health expenditures. So only the health section of the budget on prevention or public health initiatives before people get sick. And the remaining 95 to 97% is spent on clinical services or after people are ill. So we really want to see an equitable shift in how we're funding public health, so that it resembles a larger proportion of what influences health outcomes. And just to give you a perspective of what's happening in New York State, we just wrapped up our legislative session earlier this month. So we're actively thinking about public health priorities for the start of the next budget session. And as you all know, this is an election year, so there's a great deal riding on the outcomes of various seats in the legislature. So in New York, we will see a big shakeup in the legislature. There are several key retirements that are happening. Some members are running for Congress. So there's a lot up in the air in New York as to what will happen within the New York State legislature. In addition, it's a presidential election year. So that will also come into play as to how New York will be positioned based on the results of those presidential election results. And that's very much so important to keep in mind. After speaking with some colleagues who work in the governmental affairs space, the one thing to keep an eye on moving forward is our budget projections. This year, we entered a budget session with monumental budget deficit. However, when we looked at the final budget, many cuts were seemingly avoided, which is a good thing for this year. But next year, it's going to be interesting to see how much of a deficit is projected and if we're able to protect public health from future cuts, especially in a non-election year. So really, really important to keep an eye on what's happening with state and congressional budget activity. And that's something that we do at NYCHO fairly well. So finally, I want to end on a positive note because I feel like I've provided a little bit of a bleak outlook on public health workforce and resources during my time with you. But let's end by celebrating the fact that there's a great deal of potential for us to do a lot of good for public health moving forward. First, if you felt inspired by the success of this fellowship program, please reach out to any of us as presenters to find out how your organization may be able to participate, support, or even fund the program. The fellowship program really has made that profound impact on the public health workforce, which is something we can and should be proud of. I have seen many local health departments who have been able to permanently hire some of these fellows within their department and garner their interest in working within the local governmental workforce or within a community-based organization. And so while the second phase of this program is funded at a reduced capacity, it's critical that we find support for this program into the future to expand it further to the point that it was during its initial phase. We want more fellows. We want more people getting interested in working in public health. So, all in all, creative thinking, partnerships, and braided funding will set the stage for rebuilding our public health system into a sustainable, worthwhile structure. We're really grateful for everybody who took the time today to be on this call. Thank you.
Thank you so much, Sarah, and thank you to all of you for really giving us such a nice full picture of the program, its different elements, how it's operated on the ground, and some of that those issues at the systems level that we need to be thinking about. So I'm curious if we could just put a finer point a little bit on what might be some of the other ways that we could be sustaining both the workforce itself that's been infused through the public health core, but also, maybe some of the roles and responsibilities that some of those fellows have played at the local level. Is there beyond, some of it I know is funding. But Sarah, maybe you could share with us a little bit about that sustainability.
Yeah, and I'm happy to expand a little bit on what I mean by braided funding, braided and blended funding. And what I mean by this is that local health departments will often combine funding streams to support a program, particularly when funding restrictions need to be aligned to cover all the expenditures that are needed to support a program. So to achieve braided funding, I think what we need is a commitment from the state, from the federal government, and from foundational grants or private partnerships to come together to support this program as a whole. I think that gives us a lot more flexibility in being able to sustain a program like this. The other thing I'm just going to come out and say that I think we need is that Congress needs to fund the public health workforce loan repayment program, which was a bipartisan piece of legislation in the Consolidated Appropriations Act of 2023. And that would provide educational loan repayment for public health professionals. Because there was no funding appropriation, however, the program is not currently active. So that's what we're looking for, examples like that.
Got it. No, that's really helpful. So definitely there's an advocacy agenda. I don't know if others want to share anything on that point, or I have another question I wanted to throw to the group. And as a reminder for participants, feel free to use the chat if there were other questions that came to your mind. I've been monitoring and we'll be making sure to share those. So then I'm just curious, this is a question for everyone, a little bit more about, we're looking at the next phase of the fellowship program and kind of some of this workforce development writ large. What do you see as your vision for the fellows and the program in the future? And how do you see it really like fitting into maybe some of the broader workforce issues that might be happening? So I'd love to hear maybe the Department of Health perspective and then that local perspective. So Dr. Burstein, do you want to kick us off?
Yeah, sure. So we're really excited that we are able to continue our public health fellowship program, again, at a modified level. So where we had 113 fellows and then 6 fellowship supervisors, with the public health fellowship 2.0, we're only able to hire 7 public health fellows. So that's a huge cut. So what that means is we really had to prioritize the local health department programs for fellowship placement. So unfortunately, we had to the community-based organizations were informed that their fellows program was going to end on June 30th, and we wouldn't be able to continue to sustain this. And then some of our public health fellows we won't be able to continue. Unfortunately, some of them we were able to hire, so good news, so they'll be able to stay with us for hopefully a very long time. But that's not true for everyone. So it's it was really frustrating, but we excited that we do have still have the capacity to recruit new public health fellows, to keep a couple of our public health fellows that have been with us for about a year, and continue on with expansion of investment of our workforce capacity.
Great, thanks. And Erin, I'm not sure if you have any thoughts on, the future of the program, but also more broadly how it might fit into some of the other workforce initiatives.
Sure. So we are we're scaling down a little bit to 200 fellows. We thought it was really important with this 2-year no cost extension to give the opportunity to all 57 local health departments to participate. So we had it did go down, but I think we have about 50 fellows, or sorry, 50 counties that fellows will be located in. We're still doing COVID-19 response and recovery, but as people heard, that can mean a lot of things, and really, taking a look at that. We're leaning into, again, the professional development. So really making sure, giving people, the years of experience and kind of building up their skill set, because we've seen great successes. And so we're taking what worked and kind of continuing to work on that. Our fellows will be from August 2024 through July 31st of 2026. And so we're strategizing, of how we can make this a sustainable program beyond that, because we've seen great benefits, and we're working to kind of write up our findings and to make the case, by investing in our fellows, you're actually investing in public health as well. So we've got a variety of projects across the state that fellows will be working on, in all different facets, including partnership engagement to communications to epidemiology. Really, we like to say we're meeting counties where they're at and with their needs. So, what Erie County needs may vary from Niagara, and that's the great thing about the program is we try to not guess what they need, but really help fill their gaps as well.
Great, thanks. And, one of the questions kind of distinguishing that came up in the chat, but distinguishing between some of the different workforce initiatives that might be happening. So one question that came in is about eligibility for the fellows for public service loan forgiveness, but I'm just curious more broadly if anyone can speak a bit to how the program does or does not relate to some of those other either federal or state loan forgiveness programs, or some of the proposals on the table for some other loan repayment programs.
So I can say, in terms of loan repayment, right now, like depending on where the hiring entity is. So, if you're working at a local health department or at Health Research Inc., a fellow would be eligible to kind of do the federal public service loan repayment program. In the next iteration, they will not be eligible, just based on the employer of hire. The public consulting group is not eligible for that. But our hope is, it's a 2-year term, get them in the position to then be able to work for the state health department, a local health department, which would be an eligible employer to, get your 10 years of payments in.
Great, thanks. And then I'm curious also just in terms of the future of the program and some of the successes. It sounds like the New York was kind of a big leader in this space in terms of developing and launching the program. Has there been some national interest or ways to be sharing this at the national level, and have other states maybe started to take up similar programs to create some momentum?
So I can say California launched a program. It's a little bit smaller. Theirs, I don't believe is federally funded. There's Pathways to Public Health in California. I believe there are about 40 fellows. It's a 13-month fellowship. We've spoken with them about it. It's very much an entryway program, where ours is you can have, be brand new to public health. You've got years of relevant experience, where people who are graduating like from UB, and now getting that practical experience because they have the education. So we have 3 tiers of fellows, based on the type of work that they'd be doing, and their roles and responsibilities. So we do, in this next iteration, have 3 tiers. As well. In terms of other states beyond that, we're looking to kind of write up our findings. So with us ending this month and next month, we'll be able to kind of put together a research paper and publish our findings. We're also working with Cornell University to kind of write up. Ashley's on the call too. So who's the assistant director? If you can put that in the chat. I forgot what it's called, but it's basically kind of like a step-by-step guide of what we did. So someone could kind of take it off the shelf and see if they could make it fit for their county as well. So we do kind of want to get the word out and definitely hit home our successes. Oswego County was able to keep on all 6 of their fellows, right? They were able to demonstrate that this is needed, and they went to their county legislature and those 6 positions were added. So we're collecting all of those success stories and hoping to publish our findings. And thank you, Ashley. It's a lessons learned document outlining the full picture. So we're hoping to get that out more widely to to turn this promising approach into possibly a best practice.
Great. No, that's great. And we'll make sure we can
And,
help share that
you
more
know,
widely. Go
if
ahead,
I
Dr.
could just,
Bernstein.
if I could just add, I mean, the Centers for Disease Control and Prevention has had this training program for, I don't know, 100 years or so, a very long time, called the Epidemiologic Investigation Service. And so it's really like a 2-year fellowship program in, in epi and surveillance and disease investigation. And they do hire, different levels of, people from public health, from, doctoral degrees to, masters. And I think, a doctoral and master's degree, trainees that, and this is also for many people an entry point into working with the Centers for Disease Control and Prevention. So, when hopefully we can, the state pitches for federal dollars, this isn't something that is, like completely novel to the federal government.
Great. No, that's really helpful. And so we're kind of closing in on the end of our time. So I just wanted to throw out one other question and give you all a chance to, maybe give some of your big picture thoughts or some specific action that the group can take. So I'm just curious, as a closing for everyone, what might be some of the ways, from your personal perspective, that you think we can enhance the public health workforce across New York, or if there's a particular action you'd like someone in the audience to take around advocacy or learning, you could share that as well. So Sarah, maybe I'll kick it off with you.
Sure. I'd love to start. So recently the state's After Action report, which was run by or led by the Olson Group, third party entity, just was published. So we can put the link to that in the chat. But I really think it's important that, with a program like this that stemmed from pandemic need, to learn from and implement some of those recommendations outlined in the report. And I know it's 300 pages. You do not have to read the full 300 pages. You can just go through and look, like search by keyword, local health department, public health, and all of those public health recommendations will come up. And we really, I know COVID exhaustion is a thing, but we really need to think about what we learned during the pandemic and make sure that we are implementing those recommendations moving forward. And that may be a wonderful fellowship project, actually. So if that's something you're interested in, as a fellow, I encourage you, I implore you to apply for the program and become a fellow. If you're a policymaker or partner of public health, reach out to your local health department, find out what they need. How can you collaborate with them? And those are my kind of closing recommendations.
Great. Thank you, Sarah. Anyone else? Maybe I'll turn it over to the Erie County team if there's anything you want to share.
Yeah, well, we are in the process of hiring fellows for our 2.0 version. So if people are interested in an opportunity to work at the Erie County Health Department in a fellowship program. And I have to say that just like Danielle, we have some great mentors. And as somebody who has also been a mentor, I know that we have to be top at our game when we're teaching somebody else, so it makes us perform better too. But I really encourage people who are interested to apply, and we'd love to meet you and talk to you and, think about bringing you on. So thank you. And again, for the state, just want to thank you so much for this brilliant idea of helping us to fill our gaps in our public health workforce and train many others that we wouldn't necessarily be able to hire or place, giving them the opportunity to work with our community-based organizations and move on to, to bigger and better. So thank you so much. This is a great program. And I really hope that we can problem solve and think about how we can continue this.
The only thing I'll add is, right, so, our scope of our projects is based on our funding, right? So if you hear something, you're like, man, maybe you're in New York City and man, you're like, oh, I want a fellow, right? Like, our funding's the only reason why we can't do that. So if there are alternative funding or you have ideas, we're open to expanding our program, or even clinical. We can't do clinical care positions in public health because of our funding source. So we're open to ideas. If you want to chat, definitely reach out to me to learn more about the program and how we might be able to work together as well.
Fabulous. And we'll make sure to be sharing everyone's contact information and everything that we chatted today, including the application and some of those advocacy and research documents. So stay tuned in your email for the recap of this event. And I just want to really thank all of our speakers for your time and for all of your dedication every day to the public health of New Yorkers. I know you're doing all of the hard work for us day in and day out. So we really appreciate that. And for spending the time with us today to teach us about this program and how we can all play a role in enhancing it. And thank you to our audience for joining us as well. If you stay tuned on the New York Health Foundation website, we have 2 great events coming up in July as well on different topics related to primary care and veterans health. And so we'd love to have you join us at those as well. And again, I hope everyone has a nice afternoon and summer, and we will be in touch shortly. Thanks so much.